Vanakkam. Welcome to this course on biomedical instrumentation. We just started looking at pressure measurement, reference points, various types of pressures within the body and their typical values, whether they are measured in millimeter mercury or centimeter water. We looked at those things in the previous video. In this video, we look at a possible flow chart for measuring pressure within the human system and describe two types of pressure measurement, direct and indirect. And in this video, we focus on direct pressure measurement and we introduce the notion of intravascular pressure measurement. So, if you are interested in measuring blood pressure, we could classify this measurement into two broad types. One is the direct pressure measurement, which means the measuring site is the site of interest. That is, where you want to measure the pressure, there you are actually measuring the pressure. What could be the other way? Well, I am interested in one particular site whose measurement, whose pressure value I am interested in, but I really don't want to access that point. Maybe I really cannot access, or at this time for that purpose, I am using an indirect method. I am using another metric, a different pressure as a substitute for the intended value. A different site. This is the indirect method. So, direct method is measurement site and site of interest are the same. Now, that also can be classified into two types. I will come to that in a little bit. Whereas, in the indirect measurement case, measurement site is somewhere, but the measurement of interest is something else. That means that there will be a discrepancy, or there will be a, say, a systemic error. There must be a way for me to deduce what is happening in a different part of the body by measuring pressure from a different part of the body. We will discuss that in a good amount of detail through this week, so I am not going into details. Now, measurement site and interest site are different, or site of interest are different. This is the indirect case. Let us say I am interested in measuring the pressure inside a heart chamber. Wow. So, that means I need to find a way to either send a sensor directly to the heart chamber, or I can have a fluid filled catheter, an extravascular system. So, there are two ways in which I could do that. One is I can have a catheter tip sensor. Catheters are deformable tubes that are really small. They come in various sizes. For example, a famous size is 1.67 mm, for example. Now, these catheters are tipped with the sensory or the sensitive regions, or the sensors themselves. What are the various types of sensors? We have seen this in a previous video. We will discuss this in future slides, in future classes. Let us assume that I have a method to convert that pressure into an electrical signal. How is this achieved? Essentially Newtonian mechanics. So, interaction of fluid on the solid, or the not a rigid body, flexible diaphragm essentially causes deformation of the diaphragm, which causes a change in some physical quantity of interest. For example, if it is a strain gauge, that strain is then converted into resistance, which then outputs a change in the voltage, for example, or if it is a capacitive sensor, then that deflection changes the capacitance, which then outputs a change in the voltage, for example. There are different types of these, and there are advantages and disadvantages to each of these. So, intravascular is a situation in which the sensor is presented to the site of interest. This is the intravascular case. So, sensor is present inside the body. Extravascular is a situation where the catheter is sent and it is filled with the fluid, and the change in the level of the fluid is observed outside the body, extravascular, outside the body, and accordingly the pressure is modulated. This is the extravascular or the fluid filled catheter method. Now, which one is better? Well, that depends on the application, on the situation, and on the particular region of interest. How long is this going to be present in multiple dimensions? Indirect measures use a different metric to measure pressure, or measurement from a different site, for example, to measure blood pressure. The most famous of this is, of course, what you see in the primary care setting. For example, there is a manometer that is inflated that stops flow of blood, and then this pressure is slowly released, or this manometer cuff is slowly, air from this is slowly released to listen for what are called as Corot cuff sounds. We will get into the details of this in a future class. So, auscultatory method, I am going to listen for sounds. Where are these sounds coming from? These sounds are due to the turbulent nature of flow within the blood vessels, arteries. This turbulence causes sound that can be heard using a stethoscope, that Corot cuff sounds. Those details we will see in a future slide. And oscillometric technique is another method that is used to measure pressure indirectly. Now, which one would you use and when? Now, that is essentially a question of what is your interest. If the patient is an outpatient, is not having a serious condition where continuous blood pressure monitoring is required, the patient is just having a headache or a fever or cold, just a regular patient without any serious complications, is just presenting to the primary care physician, for example, then most likely this is going to be the method of choice, auscultatory method. Why not we use a catheter tip in that case? Consider that the catheter tip based method is more accurate, is direct, except the cost of doing this, is it worth? In medical science, we are always interested in identifying whether the cost of a particular procedure is worth, the risk that is being taken is worth taking. Why do we need to insert a catheter and measure pressure from the heart wall or from the heart chamber when the patient is just having a headache or cold, for example? It does not make sense. So, however, in an ICU where you need constant monitoring of pressure over a relatively long period. What do I mean by long period? Long period means several hours to several days of continuous monitoring in an ICU would require a intravascular, likely an intravascular system. If you use an extravascular system, it will need constant zeroing. We will discuss that in future slide. Will likely require a direct measurement method, unlike the indirect method or the auscultatory or the oscillometric method. An exercise for you. Can you identify what is the method that is used by the 2000 rupee or the 3000 rupee BP measurement kit that is available on Amazon. There are these inexpensive blood pressure measurement systems available online. Can you identify what is the method that is used? Now, obviously, it is an indirect method, but which one of the indirect methods, that is the question. Obviously, it is not going to insert a catheter inside your body. So, the choice of the method that you use depends on the condition of the patient. One more thing is, depending on the person who is performing the indirect measurement and the situation, there is going to be slight variations of pressure that is being measured. Their skill level matters. The medical professional skill level matters while coming to measurement of pressure using indirect method. That is not an issue with the direct method, except of course introducing the catheter into the body requires an extraordinary much higher level of skill. Now, that is a different skill, but just the measurement itself does not require skill, but sending the catheter via various arteries or the blood vessels is a skill, that actually a great skill when compared with blood pressure measurement. So, measurement itself does not require skill, but sending the catheter requires skill. So, different choices. What you want depends on the particular application at hand. We discussed this. So, direct measurement essentially is used for continuous monitoring. The advantage is it is highly accurate, it is immediate, because if you use, for example, a piezoresistive sensor, for example, it is going to be extraordinarily accurate, a very accurate system, and the system response is very fast. So, it is not like I am getting the pressure value after a few seconds after the change. You get relatively real time, near real time responses to, and this is used to measure pressure in deep arteries. How do you send the catheter to those places? Image guidance. You use image guidance. So, essentially you puncture a vessel, you perform a surgical cut and you introduce a catheter. What is a catheter? A catheter is a flexible tube that is guided to the location of interest. In this case, the location of interest is marked as heart. The most common sites are the brachial and the radial arteries, but sometimes the femoral artery is also used. Now, this comes with the advantage that you have high accuracy and near real time measurement. What is the disadvantage? Well, the disadvantage is that you are essentially puncturing an artery. So, all the risks that come with an invasive procedure also apply to this method. The other method is the method using external sensors via a fluid filled catheter. Now, in this case, a fluid level in the catheter changes inside the measurement site, and that is reflected at the externally, where you can place a sensor. What is the disadvantage? What is the advantage? The advantage is that it does not require this high end sensors and really tiny sensors that need to be placed. All it requires is a fluid that gets displaced. So, essentially a combination of solid mechanics and fluid mechanics at play here. So, fluid gets displaced and that fluid displacement is measured on the outside. There I can place a sensor. That is the idea. The disadvantage is that it takes time for this to communicate. That not the fluid flow, the change in the fluid level will have to get reflected through the entire column of fluid for me to see. So, the frequency response is not so high. So, it is not really that fast for me. Intravascular sensors, of course, have a sensor at the catheter tip, but they are more expensive and they are fast in responding, but they are more expensive. What are the types of sensors that are used? Strain gauges, various types of strain gauges are there, foil strain gauges, piezoresistive strain gauges, and then In one of the previous classes, we also discussed linear variable differential transformer. This is essentially a displacement sensor. These can be miniaturized to a great extent with the current technology. The other approaches are variable inductance and capacitance methods, so capacitive measures. And then piezoelectric sensors. What is this? This is a case in which a force or a pressure applied on a particular material changes the electric field and changes the charge contained and the electric field, and thus the voltage that is being measured. It is the piezoelectric system or the optoelectronic system. The manner in which light reflection happens changes as a function of the pressure that is being applied. And then you have semiconductor based systems, that is piezoresistive systems or MEMS based systems. There are many different systems that use semiconductor approaches to measuring, in this case measuring pressure in general as a measurement element. So direct method essentially involves two types. One is an intravascular system in which a catheter tip is sensorized. The other is an extravascular system in which there is a fluid filled column, a fluid filled catheter whose level is going to change depending on the pressure that is going to be applied. Both have their own advantages and disadvantages. Both have the disadvantage that they require a catheter to be inserted. So any risk that comes with the puncturing of the body comes with this case also. One type of intravascular sensor is discussed here. Intravascular sensors are those that are placed directly at the tip of a catheter without having a liquid or a fluid coupling the sensory tip or the tip where there needs to be a sensor and a measurement site. So there is a liquid column that is present. In the fluid filled catheter case, that is replaced in the intravascular system where the tip itself is entirely sensorized. They are extremely accurate and they are having high frequency response. So the time delay between when the change happens and when it is measured is nearly zero, minimal, quite minimal. What is our interest? We are interested in measuring the displacement of the diaphragm as a function of the blood flow, for example. Now, how would we measure the displacement of the diaphragm? What is happening? What is happening is that I am having a deformable diaphragm that is being hit, that is in constant interaction with a fluid, that is blood in this case. We are also interested in other flows and we are also interested in other pressures. In this case, say for example, I am interested in blood pressure. So this deformable body is in constant interaction with the fluid that is exerting the pressure. There is a direct relationship between fluid flow and the deformation that you measure, and if the deformation can be expressed in electrical terms that can be measured, for example as voltages. If it is capacitive, then the capacitance will change. If it is piezoresistive, then the resistance will change and the voltage will change. If the capacitance changes in the capacitive sensor, then that will also cause a voltage change, and I am measuring the voltage outside, for example. Then assuming there is a linear relationship between the change in the pressure and the change in the voltage, all I need is a reasonable calibration data that will tell me what is the value of the pressure for a given voltage that I am measuring, for example. And this is linear over a relatively large range or the range of interest, for example, usually. So with this we come to the end of this video. In this video we looked at various types of pressure measurements, flow chart of pressure measurements, direct and indirect. Within direct we discussed two types, intravascular and extravascular, and within indirect we discussed two types, auscultatory and oscillometric. Which one we use depends on the particular clinical requirement and the skill of the clinician and the requirement for the patient to have indirect or direct method, which one is needed. In most primary care settings we use the indirect method or the auscultatory method, which we will discuss in future classes. The advantages and disadvantages of using the various types of sensors and various types of this one versus intra versus extra, direct versus indirect we looked at, because direct is an invasive procedure. You do this only when you absolutely need it. You do this in an ICU, you don't do this for an outpatient, for example. And we gave an example of an intravascular sensor. We will continue this discussion in a future video. With this, we come to the end of this video. Thank you for your attention.